Earlier today, the Wisconsin Department of Health Services identified a second reported case of the UK variant of the coronavirus in Wisconsin.
Researchers believe this strain spreads more rapidly than the original strain, and there is some evidence that it may increase the chance of death.
Here to talk about that and other coronavirus news is UW Health Chief Quality Officer, Dr. Jeff Potoff. Jeff, good to see you again.
Good to see you guys, too.
How concerned are we about this variant?
I mean, the variants are reason for some concern. I think as it pertains particularly to the United Kingdom, the B117, that's a little bit kinder variant to us. We know that it's more contagious, but it's not all that likely to escape immunity, especially immunity from vaccines. So the game plan stays the same. You know, we need to mask, we need to distance. If we get vaccinated, likely we'll be protected from this particular strain.
A lot of people locally who were expecting to get their COVID vaccine today had their appointments rescheduled because there was a lack of supply of the vaccine. What happened with that?
Yeah, I think, you know, in general, I think we have vaccinators who are really stepping up. They've created processes that allow them to vaccinate large numbers of people. I know here at UW Health, we can vaccinate, 1,000+ people per day. And the supply coming into the state isn't enough to meet that. I think we have to look really carefully at, how do we allocate that? Clearly, that's a difficult job because there is much more request for vaccine than there are doses to give. And although, we hate postponing a vaccination appointment just as much as patients hate getting that notice, we have to do it if we don't have doses.
Is there anything UW Health can do to get more doses?
I think, we're committed to working with DHS on our shared goal of getting the state vaccinated. We've made them aware of our concerns of the acute shortage, and particularly, our large group of age 65+ individuals. But we look forward to working with them on solutions that really meet the needs of our patients and our communities here in the state.
I got an email from a viewer today asking about the second dose. And Jerry wrote and he asked if obviously you want to take the second dose at the prescribed time, but how long can you wait before you take it? Can you wait as long as 30 days, 40 days before you take the second dose?
This is a good question. So the way that it's set up right now is usually there's about a 5-day window kind of on that backside where you can still get that dose, and we kind of call that good. There is research that looks at what if you wait much, much longer. And this comes out of those studies, particularly out of the United Kingdom, where they're trying to give everyone their first dose and then sometimes waiting 12 weeks to give that second dose. And they're finding even at that 12-week mark, if you get your booster at that point, your immunity is still strong. So not advocating for skipping that second dose, but at the same time, if it gets pushed back a little bit, so far things look like they're okay, but we just need to understand more before we would actually, promote a plan where we would delay second vaccinations.
The government's going to start sending vaccines to pharmacies like Walgreens. Does that change the protocol on how you know if you're going to get the shot?
Not necessarily. I think it's always good to have more vaccinators. At the same time, the more vaccinators we have, the more confusing it might be for people to figure out where should they go get that shot. And worst case scenario would be someone signing up for a vaccine in 4 different locations to try to get it at location number 1, and then not tell location 2, 3, and 4 they have the shot, which would then lead to an extra dose at the end of the day for that vaccinator. So it can complicate things, but at the same time, more is always better.
We're also getting a lot of questions, Dr. Potoff, about post-vaccine behavior and what you should do and what you should not do. Do you still have to wear a mask, or can you basically just do whatever you want? What's your advice?
Yeah, I can totally understand this question. So, our advice right now is after you get vaccinated, at least right now in February, still wear your mask, still distance. And the reason for this is not because the person that is vaccinated is at risk of getting the disease or getting severe disease. But what we don't know yet is if you're vaccinated, can you still transmit that virus to other people? So for those of us who are vaccinated, we wear a mask and we distance, not because it makes a big difference for us, but because we want to keep other people safe. Once enough of us have become vaccinated, then we can take off the mask and have a good time hanging out together. But until then, those of us who are vaccinated do still need to toe the line.
A year into this, still questions that we still can't answer. Doctor, thanks for being with us today. Good to see you again. Stay warm.
Thank you, Dr. Potoff. Appreciate your time.